Go ahead.
Hi, good evening, everybody. I am Dr. Pallavi, Junior Consultant at Oasis Fertility Center, Pune. Welcome to today's Facebook Live session. Today, we will be talking about one of the most important and interesting topics and most frequently asked question that how to improve IVF success rate. Actually, Dr. Nilesh Balkawade sir was supposed to guide us through this topic, but because of some emergency, sir is not able to attend. So, we have here Dr. Saili Chavan, Senior Consultant at Oasis Fertility Center, Kharadi, to join us. Good evening, madam.
Good evening, Pallavi. So, good evening to everyone and welcome for this Facebook Live session.
So, as there are numerous factors that impact the IVF success rate today, we discussed about the topmost five important points that improve the IVF success. So, madam, can you tell us about the quality of egg or sperm or the embryo? How does it impact the IVF success?
Okay. So, when a couple wants to attain IVF success, one of the most important factor is going to be the quality of the eggs and the quality of the sperm, which in turn is going to, form a good quality embryo. Only when we have good quality embryo can we, give them a good pregnancy or the pregnancy, that can, advance properly up to 9 months and deliver a healthy live baby to them. So there are various factors that are going to kind of have an impact on the quality of the eggs, quality of sperms, or per se even the number of eggs or the egg reserve and the number of sperms, the quantity of the sperms that is there in the sample. So when we want to improvise or improve on the quality of your sperms or oocyte, one of the most important factor in today's world is to limit your stress. Since every day the people everyone is in a hurry, they are like dealing with multiple stresses at home or at workplace. So this is kind of having an impact on their fertility also, because this is degrading the quality of their sperms or the quality of the oocytes. So here, decrease your stress level, have an adequate sleep, follow proper dietary pattern, have meals, the right amount of meals at the adequate times. People are not following the timely meal pattern, they're not eating the right amount of food. They are like uh, too much of fast food, too much of carbohydrates, sweets, all of these things, the ready available meals they are taken in the diet. So this kind of is having an impact on their fertility, they're having an impact on the quality of their sperms and the oocytes. So definitely a healthy lifestyle that will incorporate healthy eating, having good amount of proteins in your diet, having your antioxidant or like foods which are rich in antioxidants or supplements that is going to deal away with the stressful factor, deal away with the toxic substances that is there in the body. Have the adequate nutrients in the right amount, restrict your calories so that you can maintain your weight in the healthy range. Try to have an adequate BMI. So to have a maintain a healthy weight, we can either have a proper diet or you can do exercise. So exercise at least should be followed at least for 3 to 5 days in a week, at least of 40 to 45 minutes. If you're not hitting the gym, or if you're not doing any form of hardcore exercise, at least you can give a slow pace jogging or fast walking. That will kind of get your heart rate pacing and at least help you to decrease weight and help you to have a healthy life. Adequate sleep, so at least try to aim at having a proper night sleep, at least 8 hours of sleep should be taken. Then the next important factor is the addictions. So if you want to kind of improvise on your fertility, then you have to give away with the addictions. Any form of drug abuse, any form of alcohol or smoking, everything needs to be stopped, because these things definitely have an impact on the long term fertility. So these things have known to impact on the number of your oocytes. These are having an impact on the quality of them. Specifically in individuals, they are having an impact on the sperm quality, the motility of the sperm, or the overall quality. So when these sperms or oocytes, the quality is deranged, the resultant embryos that are formed, the quality is affected, and these individuals might not attain pregnancy that easily. Second important thing is, apart from giving away with your addictions, is the individuals are exposed too much to radiations. So any form of excessive exposure to radiations, they restrict your screen times, restrict the use of laptops, excessive gymming. These all things can have an impact on fertility, because radiations per se, they affect the quality of the eggs, and second thing, they increase the total temperature. So when excessive radiations or excessive use of heat is there, or use of hot water, so males as that have to kind of do away with this. Then the second thing is, when you want to know about the quality of the sperms and the quality of your eggs, you also need to get your egg reserve and the semen analysis done. So in this, basically depending upon your, the reserve of eggs. So if you're a PCO patient, if your AMH levels is on the higher side, then, to improve the quality, we can start you on metformin, we can start you on inositol, we can start you on low dose steroids. That is, going to like improve the quality of the eggs. Actually, PCO comes with multiple follicles, but these follicles are immature. So these medications, or a proper diet, a proper lifestyle, can improvise. They can improve your the menstrual cycles, and they can improve the quality of the eggs that are there. In individuals who have a low reserve, we can give them DHEA supplementations. Individuals with a normal reserve, or individuals in whom the semen analysis is poor, the motility of the sperm or the count of the sperm is low, antioxidants help to remove the stressing factors from the body, and they can improve the overall quality. So as we have said, a healthy lifestyle, maintaining the adequate weight, doing away with your addictions, not to expose yourself to too much of radiations. These factors can definitely help you to improve the quality of your eggs and sperms, and this per se can improve the IVF success per se.
Okay. Ma'am, next comes the embryo selection. So among the many embryos, how are we going to select the best?
Okay. So when it comes to embryo selection, basically when the embryos are formed, we do the morphological grading of the embryos. So based on the external appearance of the embryos are graded into different grades as grade 1, 2, 3, 4. And depending on these, the best quality grade of embryos based on the morphological assessment is selected. But we don't know what is the genetic makeup of these embryos. We don't know, like, if there are any genetic abnormalities in it. So in individuals who have, had recurrent pregnancy losses, or those who have recurrent IVF failures, or in individuals who are of advanced age, in whom the risk of these genetic abnormalities are on the higher side, we have methods where we can, go ahead with the genetic testing of these embryos, and they will per se help in the selection of the best embryo. Individuals who have a normal karyotype, like they have no karyotype abnormalities, in these individuals, we can go for an invasive testing where a biopsy is taken of the day 5 embryos, and we can send these embryos for a PGTA analysis. In this, we will come to know about the euploid embryos, or embryos which are absolutely genetic normal. And if you go for the transfer of even a single euploid embryo, the success of pregnancy will be around 80 to 90%. In individuals who have some abnormalities in the karyotype, such as if there is any structural abnormality, we can go for a PGT-SR, or if there is any more, a monogenic disorder, we can go for PGT-M. So specifically, these are abnormalities which are there in the parents, and we don't want these abnormalities to be there in the child. So these abnormalities per se can affect the pregnancy, that can affect the IVF success rate, or it can affect the continuation of the pregnancy. It can result in increased risk of miscarriages, or the babies being formed abnormal. So among the invasive methods, we have this PGT-A, PGT-SR, and PGT-M. Coming to the non-invasive method of testing, in this we have the non-invasive PGT, in which the embryos that are formed, the fluid that is there, that is specifically sent for the genetic analysis. And similarly, we'll come to know about the genetic abnormalities that are present. Now, when an embryo is formed, we have something which is known as a time lapse. Now, this time lapse is going to take, these sequential images of the embryos, and this will help us to know the stepwise formation of these embryos. If it is dividing adequately, what is the structure of the embryos, and how the embryo is formed. And if the right stage of development is reached at a particular time, then this kind of can indicate that the embryo is going to be genetically normal, or it is going to be of a best quality. So by utilizing these genetic analysis, or utilizing the time lapse method, we can help these individuals select the best quality embryo, and when we can go for the transfer, that will definitely give us the better success results.
Okay. Ma'am, is the transfer of day 3 better or day 5 embryos better? And please add a note on laser assisted hatching and its role in improving the ART success.
Okay. So day 3 and day 5 is basically the developmental stage of the embryo. So day 3 embryos are basically 6 to 8 celled embryos, and day 5 embryos are around 100 cell plus embryos, in which the inner cell mass, the trophoectoderm, the outer cells, they are already formed. So when we discuss in terms of success, when we have a non-genetic tested day 3 or day 5 embryos, when we go with 2 day 5 embryo transfers, the success rate is going to be around 70 to 75%. With a single day 5 embryo transfer, the success rate is around 50 to 60%. When it comes to day 3 embryo transfer, the success rate with 3 day 3 embryo transfers can be around 40 to 50%. So definitely based on these numbers, you can say that day 5 embryos have a better success rate than the day 3 embryos, because as we know, some of the embryos can go to a day 3 arrest. Not all of the day 3 embryos are going to progress to the day 5 embryos. So definitely when it comes to success, day 5 embryos can give better success. But definitely, if we have good quality day 3 embryos, they can also give us good success rate. Now, coming to the laser assisted hatching thing, laser assisted hatching helps in the hatching of the embryos at the proper time. So, most of these individuals, like we are going with a frozen embryo transfer, especially in individuals who are PCOS, we don't want to immediately transfer them because the success of a fresh transfer is not very good. Even individuals who have a thin ET, like we cannot go for the immediate transfer because the endometrium by that time is not well developed. So when we go for the freezing of these embryos, maybe the outer covering of these embryos are thickened and they might not hatch at the right time. So the laser assisted hatching method is something that will help the embryos to hatch at the proper time, and therefore this will help in the better implantation of the embryos, and they will help in the better success rate.
Okay, ma'am. Then, ma'am, please add a note on the endometrium and how does the endometrium play an important role in the IVF success?
Okay. So now when we have good quality embryos, when we have PGT tested embryos, we know that everything from the embryo or the baby aspect is good. We require an equally, good endometrium. So we require proper triple line endometrium. The thickness of the endometrium should be anywhere above 7 mm to 12 mm at least. The blood flow to the endometrium should be good. So definitely endometrium plays a very important role when it comes to the implantation process, when it comes to continuation of pregnancy, and when it comes to decreasing the risk of miscarriage in the future. So individuals who have a thin endometrium is basically individuals who have an endometrial lining which is less than 7 mm, individuals in whom the endometrial blood flow is not adequate. Basically, the blood flow, the endometrium is divided into separate zones, and we usually aim at a vascularity in the zone 3 to 4. That is, the blood is reaching the innermost layer of the lining of the uterus. Then only can this endometrium support the pregnancy well. Can the blood be delivered to the baby at a proper rate? So when we have an endometrium which is thin, maybe that endometrium is not apt to implant the embryo or carry it till term. When the vascularity is less, maybe it cannot provide the adequate nutrition to the embryo. So definitely in individuals who have thin endometrium, we have to move ahead with procedures such as we can go for an endometrial scratch that will help in improving the thickness of the endometrium, that helps in improving the vascularity of the endometrium. We can move ahead with something which is known as a metroplasty, where a thin endometrium, we can expand the cavity, or something which is known as a PRP. So these all methods that will help us in improving the thickness and overall success of the cycle. Another note to add is individuals who have thin endometrium, we will not go for a fresh embryo transfer. These individuals require prolonged time for the development of the lining. So these individuals we usually go for the hormone replacement therapy and go for a frozen embryo transfer. Coming to the vascularity, as we have said, the vascularity needs to be reaching the zone 3 or 4 of the endometrium. There are certain factors that can improve the vascularity. That is, we can do a PRP, we can add in sildenafil, we can add in lower molecular weight heparins or arginine supplementation that will help in improving the blood flow to the uterus.
Okay, ma'am. Immunotherapy, the word which is gaining most popularity nowadays. Ma'am, can you please tell us about what immunotherapy is and what is its role in ART?
Yeah. So especially as we have seen individuals who have, like these recurrent pregnancy losses, or individuals who have these, good quality embryos are there, good lining is there, everything is nice, but they are not able to attain pregnancy, or they're going into recurrent miscarriages. So these individuals, we say ki immunological therapy can play an important role. Now, what is immune therapy? This is basically there are antibodies in the individual's body that is kind of attacking on these embryos and they're not allowing the pregnancy to be sustained. So we can do a screening of these antibodies. The routinely done testing is for the natural killer cell, the TNF alpha. We can look for the APLA, ANA. We can look for the anti-sperm antibodies. Now these are basically factors that are, antibodies that are not, attacking against your sperms, antibodies that are attacking against the embryos and are not allowing them to progress. So immune therapy out here can play an important role. So what other treatment options available? So we have something that is known as IV intralipid, and the most there is something known as the IV immunoglobulin therapy. When we give the IV immunoglobulin therapy, the immunological basis is kind of we can get success through it. So this IV immunoglobulin injection can be given to the individual prior to the transfer, and if the patient conceives, then every 21 days we have to give this injection for at least a period of 24 weeks of gestation. So individuals who have recurrent implantation failures or recurrent pregnancy losses, and they have some immunological factors associated. So these immunoglobulin therapy can help them in continuation of pregnancy and give them better results with it. Okay, so in individuals who have recurrent pregnancy losses or individuals who are not able to implant the embryo even after good quality of embryos, there is something known as a lymphocyte immunization therapy that is also available. So especially in this, the mother's blood is sensitized with the husband's blood cells, husband's lymphocytes, and this will help in prevention of the rejection of the embryo that we are kind of transferring inside the uterus.
Okay. So thank you, ma'am. Thank you for giving us so many important points regarding how to improve the success rate. So the important things are we have to improve the quality of the eggs and the oocytes so that the embryo quality is increased, and the best embryo selection method has to be chosen, and transferring a day 5 blastocyst with a laser assisted hatching is important, and preparation of optimal endometrium and endometrial environment is important for IVF success rate. So thank you, ma'am, for enlightening us with all these topics.
Okay, so thank you, Pallavi. Very nice questions from your side. So I think this is all that we have from us. Hope this session was useful to our viewers. Let us see if you have any questions which are coming over from them.
Yes.
Okay, so the first question that we have is, what age is IVF most successful? People come with this misconception that IVF is only for the advanced age. So definitely you have to understand that if an individual is more than 35 or per se more than 37 years of age, so in these individuals, the risk of genetic abnormalities is on the higher side. So, the probability of getting good quality embryos because of the declining reserve and the probability of getting genetically abnormal embryos is higher in individuals who are, above 37 years of age, and more so in individuals who are above 40 years of age. So, definitely, what age is most successful for IVF? In this, we have individuals who are less than 37 can give us better outcomes. But definitely in individuals of advanced age, if we have PGT tested embryos of good quality, in them also we can get better success. So the next question is, how many eggs is good for IVF? So now this question asks you how many eggs, but what is important for us is how many good quality, how many mature eggs are there. So the results of IVF are not only going to depend upon the number of eggs, it also depends on the quality of the eggs that are available and the number of good quality embryos that are formed. So we require at least a total of at least 10 to 12 eggs to give us those adequate number of embryos so that we can give a good enough success of IVF from these individuals. Yeah. So the next question is, can I make myself physically stronger for IVF? Yes, definitely. You need to make yourself physically stronger through IVF. So as we have already discussed prior, that you have to improvise on your lifestyle, healthy lifestyle with good, quality of eating, having the right amount of nutrients, having the right amount of protein, regular exercise, good quality sleep. This will, help you make, it will make you like bodily, physically stronger, and this will also make your IVF journey a little better, or a little easier for you. Okay, so I think these are all the questions that we have from the viewers. So thank you, everyone. I hope the session was useful to all of you. Thank you, Pallavi, for such wonderful questions.
Thank you,
Okay,
ma'am.
so
Thank you for your nice
I think we
elaborated.
will. Yes. So I think we can end our topic out here. And for any queries pertaining to this topic, or if you have any help needed from us, you can dial the helpline number that is given below, or you can reach us physically at any of our two centers. That is Oasis Fertility at Kaspate Vasti at Vakad, or Arisa Avenue at Kharati. Thank you, everyone.